Okay, today we're going to demonstrate the proper procedures of Peri care. What you will want to start with is, first of all, you want to wash your hands and you'll want to gather your supplies. You're going to need at least 5 garbage bags and also, of course, your Peri rags. Go ahead and you'll need at least 6 Peri rags to wash the front, 6 to rinse the front, and 1 to pat dry. You will also need 6 to wash the back, 6 to rinse the back, and 1 to pat dry. So once you've gathered that stuff, and don't forget too, you want to always put some toilet paper in your bag in case you run into a BM situation. So go ahead and gather your stuff and let's get ready to start this process. Okay, the next thing that I'm going to do is I'm going to have my supplies and I'm going to enter the patient's room. And I'm going to, well, before entering the patient's room, I'm going to knock on the door and wait for just a few minutes to make sure that they respond. If they're not able to respond, and I know that, I still want to show them the dignity of knocking on the door and giving them that opportunity. At that point, I'm going to go ahead and enter and let them know, Mrs. Jones, hi, my name's Angie, and I'm your nursing assistant, and I'm here to either clean you up or clean your private area or Peri care, whichever you choose to use. At that time, then, I'm going to go ahead and pull my privacy curtain and also close my blind. And then we're ready to begin.
And they also want to make sure they close the door.
Right, and make sure that you close the door as well, because the state surveyor, if they're walking in behind you, they will not close it for you. Then I'm going to apply my gloves, and my partner's also going to help me out here. And I'm going to have her go ahead and raise the patient's gown. And I'm going to have her remove the brief. Now we're ready to begin the Peri care process.
Okay, one thing I will point out, make sure that your partner, if they have soiled gloves after they remove that brief, that they do not touch anything such as the patient's gown, their bed, anything like that in the room, because surveyors really watch for that.
Okay, the other thing I want to say to you is if we would have a BM situation that we run into, I did gather toilet paper in case I needed that to remove the excess of the BM. Otherwise, since I don't have BM, I'm going to go ahead and start here with my soapy rags. Okay, I'm going to pull the labia apart and I'm going to wipe down the center here. One swipe all the way down, and then I'm going to put it into my dirty bag. I'm going to swipe down each side of the labia on the inside, that is, of the labia. And I'm just going to keep washing outward until I've cleaned the entire Peri area. And then you always want to make your last swipe at the top. Now, if you noticed, I didn't move my non-dominant hand. I kept it on the patient the entire time. This helps me prevent from cross-contaminating. So once you lay that hand down, you don't want to move it, because the chances of you touching, you will end up cross-contaminating. So make sure you just keep that hand stable. Okay, I've finished the soapy process, so now I'm going to start the rinsing. And you do it the same way as the washing. Make sure you do wash down the thighs, because urine does get travel there. And again, you want to end with your swipe at the top. Now you just need 1 rag, and you can pat dry. I do kind of turn my rag and use as much of it as possible. And that completes the front. At this point, we're going to provide privacy for the patient. So I'm going to go ahead and cover up the patient here. and I'm going to let my partner go wash her hands, and I'm going to stay with the patient so that the patient doesn't run the risk of falling out of the bed. And then when she gets back after she's washed her hands, then I'm going to leave and go wash mine, and she'll be with the patient.